this, you know, the whole thing will be set up. But they're not expecting us to know how to set up the alarms because it's not used that much. Like I said, I use it at Children's, but they have like a whole different way of giving medication to children than they do to adults. So, I started this earlier, but since you guys are some of you guys just joined us, what would this be considered? Primary? And then this is going to be your secondary, right? And your primary, almost always, if you're doing piggyback, actually always is going to be normal saline, because you're going to be using the primary bag, which is going to be normal saline, as a TKO, which is to keep the vein open. Basically what this is going to do is it's going to act as a flush for your medication the antibiotic that you just given, because you want to make sure that the patient has received the entire dose of antibiotic. Okay? So what we're going to do is also identify one more thing. Based on these two, which one's the primary, which one's the secondary?
That one is primary.
Okay. And what makes this the primary?
Long, cute.
Okay. This actually doesn't have it with it. I'm looking for, it's like a little white hook.
Oh, right here. Oh,
Yeah, this would be inside of a secondary bag, and this would make it a secondary. You need this to lower down your primary bag, right? So secondary, you'll know because you'll see the hook included in there. It won't be in the actual primary set. Alrighty, so what we're gonna do is practice first a general idea of how to set up IV piggyback. So what I'm going to do is I've grabbed this out of the med room and everything, and I'm just going to go ahead and hang it on there. That's fine. And have you guys ever heard about priming an IV line?
Yeah.
You've seen your nurse do it, right? Okay. So I have a brand new primary line, so that's perfect.
So that competency, will they have the primary or
Chances are that the whole, I mean, and this is just based on like what I got, it was set up, but they said that they may ask you to set it up on your own.
Mm-hmm.
So I'm just showing you guys so that you guys know how, I don't know why I'm having such a hard time getting this open, know how to set it up even in the hospital on your own. Because some nurses will be like, oh, do you know how to do IV piggyback? You say, yeah, okay. And you know, they'll watch you do it. You won't even. So it comes like this, right? You're gonna take all this cool stuff off, and the first thing you're gonna do is when you get a new primary set, is you're gonna go ahead and make sure that everything is clamped. Everything comes unclamped, and by unclamped I mean that you see this, so able to pull it through, able to pull that through. Let's go ahead and make sure everything is clamped first, right when I open it. And those are the only two right here. This one's a short one. Okay. One thing I'm keeping mind of is that I'm kind of untangling it, but this part is going to absolutely remain as sterile as possible. Why? Because this is going inside of the IV fluids. So I'm not gonna just pop this off right now. I'm gonna actually wait until I get closer to the bag. Now that everything is clamped, what's the rationale behind everything being clamped before I go ahead and spike this bag?
For the liquid that's going
Okay.
You want to watch the fluid go in so there's no bubble.
Okay, that, and then also, if you said what now? It's gonna drain out. So if I just go ahead and spike this, even if I were to spike it sitting up like that, it's just gonna start running.
Yeah.
So you need to make sure everything is clamped. Some people leave this on here and spike their bags. The term is spike when you take this off and put it in. I like to just have the bag off and be it upside down. So what we're gonna do is gonna just put the bag upside down, and here I go. I'm popping off this, popping off this one, and I'm just gonna insert it. You're gonna twist. Twist. So twisting motion will get it all the way in there, okay? Now, when I flip it upside down, nothing drains. So my first step is to ultimately, like I said, prime my line. And the reason being is that I want to make sure that everything all the fluids can easily travel from inside of the bag all the way through the IV tubing, and that there's no air bubbles, because as you know, if you air bolus a patient, that can become dangerous, right? So there needs to be absolutely no air inside of your line. So you need to have maybe a trash bag nearby, or some nurses even like keep it like this. I don't know if you guys seen. And they just kind of put it in there and watch the fluids flow through. But I like the trash can. If you don't have one next to you, it's fine to do it that way. So what I'm gonna do is I'm gonna go ahead and I'm gonna do like that. This is called the drip chamber. You wanna make sure it's at least halfway full, right? And then you're gonna go ahead. I should probably move this up. This one first. And before I do that, actually what you can do is kind of unscrew this just like a tiny bit, but don't take it off all the way, because this is going to be going on into the patient as well. We're hooking up to their saline lock, just a little bit. We're just going to go ahead and let it prime. As you can see, it's dropping out, right? Do you guys see any air bubbles? That little one is fine. Mainly up there would be a concern, like really big ones. The other ones you can kind of flick at, or you can use a empty syringe, which I'll show you in a bit, to remove air bubbles. That's fine. Now that it's primed, I can go ahead and lock it back. The reason why I'm moving this up is because now that we've primed our primary line, I'm gonna get ready to start it on the machine, okay? So this line is primed, there's no bubbles in it, it's ready to be set up. You're gonna turn on your Sigma pump. In order to get this open, you need to insert it like this. It's gonna be like a key almost to set up inside there. Then it's gonna ask you to load it. 1, 2, 3, there you go, it's loaded. The whole thing, it's gonna ask you to close the door. Simple, right? This setup is gonna be different on an actual pump, but for purpose of competency, it just says general care, you're gonna say okay. You would type the first 2 letters of the drug name. This is normal saline, so in the hospital, you're gonna push I, you're gonna push V. 0.9 normal saline may come up, 0.45 may come up, but any of those as your primary will show up, and then you're gonna just scroll down, which it doesn't have also, and you're gonna pick which one. Let's say normal saline. We're just gonna go ahead and push OK. This is basic. Okay, so this is the primary, okay. Say this is a TKO, right? To keep the vein open. We mentioned earlier a TKO runs at how many mLs per hour? 5 to 10, right? So your mode is mLs per hour. You're gonna go ahead and click OK. Your rate, let's say we're gonna program it to 10. Oops. Here, G. Okay. And then the volume to be infused. So we're gonna say that this bag has 500 mLs, assuming that it was all the way filled up, right? I'd maybe program it in the hospital to 550. And does anyone want to take a wild shot or wild guess as to why I program it more than the actual volume?
To make sure everything's out.
The bag needs to be completely empty, right? And not so much for normal saline, because that's just kind of like sodium chloride. It's already in our body. We have it. It's not anything we're going to be missing out on. But when you for sure program your secondary, which may be an antibiotic, sometimes this machine will beep and it'll say that your infusion is complete, but you'll see, oh, I still have like a little bit of medication left in there. Well, that's why some nurses program it maybe 10 mLs to 20 mLs more, so that the bag is completely air flat. And then this will start draining, right? You don't want to still have medication in there that your patient's missing out on, like potentially some of their medication, right? All right, so let's say that we're going to program this to 550, and for purposes of competency, you can say this. They don't mind you saying that. I would program it more, because as a nurse, that's what you would do. Some nurses don't mind coming back and changing it every time their machine beeps. But for me, the beeping is annoying, so I'm just gonna go ahead and prime it, set it up as more. Right, so let's say 550. Let's say okay. Okay. This is the last step after you hit okay, right? Because now it's going to ask you to program your secondary. So with that being said, I can just place this like this and grab the materials that I need for my secondary. Which is secondary tubing and my antibiotic, let's say, is cefazolin, right, or something like that. So I took this out. Same thing. Everything needs to be clamped. Everything comes unclamped. So you want to make sure first you do that. The NRL equipment is a little bit different than what you actually get in the hospital. Okay, I need alcohol. There's one from the top. Thank you. Secondary bag is your antibiotic, secondary tubing, correct? Alright, so what I'm going to do now is the same thing, almost like what I did with my primary. I'm going to take this top off, and I'm keeping this sterile as well because it's going to go inside. Just going to do it like that. There's air inside of it.
Why the 2 on that one?
Well, I'll tell you right now where there's. I did the wrong one, that's why. The one that I just pulled off is not where you stick it, okay? Stick it in the wrong place. Alright, so this is actually if your patient ever needed like protonics mixed in, if this was like a primary bag, the nurse would actually take a needle and push all of the reconstituted protonics inside of this. And when your machine makes any type of inactivity alarm, any button will silence it. Any button. Okay? You can even push the number 1 and it'll be quiet. So basically you're going to do the same thing as what I did the other bag and twist it. Not too hard though, because this is cheap tubing. Right through. Like this. And by this time, this is where you're gonna actually connect your secondary to. But why do I have an alcohol swab? Okay, because this has been exposed to air for a little while, right? So what I'm gonna do is that to make sure it's not contaminated or anything, before I connect my secondary to my primary, still scrub for I guess maybe 15 to 20 seconds. You remove the cap to this one. Just not coming off that easily. Sorry guys. And connect those two together.
Are you just picking the highest port?
Yeah, so it's the port always above, it's the port above the pump that's gonna be what you're connecting your secondary to. So it'll almost always be this one, not this one down below at all. Because this is actually, if a patient is continuously receiving fluids, you can potentially push medications to this one. They have a saline lock like we just went over, you push through that. They have running continuous infusions, you'd pause it, and then you'd push through this one right here, or the one that's closest to the patient, okay? So how do I prime a secondary bag?
You lower first. Touch lower.
And does anybody know what this is called?
Back priming.
Back priming.
Like, that's urgent care business, dude. That's urgent. You got a cough for 3 weeks. You're not gonna die tonight.
So back priming basically means that I'm making sure that the secondary line is patent, right?
Mm-hmm.
So what I'm gonna do is now that that's all set up, I'm just gonna go ahead and open this up. And you see that my normal saline goes back into my secondary. And it's fine to mix these two because normal saline can almost mix with any antibiotic. Now, say there was an instance where you're back priming with something that maybe they can't mix, which would never be the case because you're almost always going to use this as a primary bag. There would be a reason why you can't back prime, right? Because those two medications would interact. But that's not the case, okay? So, to do that, then I can make sure my drip chamber is halfway full always. Bring this back up. And what's the next step? Lowering the primary. Thanks, John. So this is what your setup is going to be. This always gets a single back. Oops, and this wouldn't touch the ground at all, why? Because it's going to the patient. Okay, so then I come over to the patient, and I can pretend.
Do you have to?
I have to program it. I have to program my secondary, right? So it was asking me after I program my primary bag to program my secondary. So go ahead and click program secondary. Then you're gonna same first two letters of the whatever the medication is, but this won't do it because it's for learning purposes. You can push OK. Next step is just to hit basic, hit OK. The secondary bag is what you're programming. So hit OK. So the prescribed rate for this might be like 25 mLs an hour. Whatever they give you is what you're gonna basically, they ask you to put inside. So let's say that the mode is in fact mLs per hour. Let's say it's 25. You're gonna hit OK. Volume to be infused. This is a 50 ml bag. I'm gonna go ahead and say I want it to volume to be infused to be 60. The extra 10 because you want all the medication to be completely, you want the bag basically to be flat, and then you want this to start running after, correct? So then I push OK. For some reason, it didn't pick up on my 10 mLs that I wanted the rate to run for my primary. So I'm going to go ahead back up to rate mLs per hour. Push 10. Secondary, everything's set up there. And you will get this alarm if this is not unclamped, right? Because it needs to make sure that the medication is going to be going to the patient. So you need to make sure that this is always unclamped, and then what you're going to do is this one too, Josh said, and then you're going to go ahead over to your patient. It's going to ask if drops are falling into your secondary. So you literally have to wait to see a drop to know that it's starting to pull, right? So I'm just going to go ahead and hit yes. By this time, this will already be connected to the patient. This patient doesn't have an IV, so it's going to be kind of tricky. I could connect it over there, but don't want to do that. Basically, this blue part has to come off right before as everything is set up, pop this off. Go ahead and scrub your port where your patient is, attach this, because of course that's been exposed, and it's already running already. And then you're just gonna go ahead and hit yes. You see the drops? And your secondary is gonna begin infusing at 25 mLs per hour. After that's done, infusing completely, your primary will start pulling as a flush. That's a flush. Now this might ring you back if there's any air in the line or anything like that. Sometimes air gets in the line and you need to remove the air with like an empty syringe or something like that. Or the patient might have their arm in a weird way where it's kinked and it's saying the kink in the tubing or something like that. So you want to come back frequently to check, when you start running a primary or IV piggyback, you don't want to just leave the patient. You want to always come back. The machine will obviously alarm you, but you want to come back and reassess everything, make sure that it's running properly. A lot of nurses, what will happen is that sometimes they'll leave this clamped. And what's the problem with leaving this clamped?
Nothing's going in.
Nothing's going in, and it's been running supposedly for 2 hours. And nothing has gone in. Now the patient's medication is late, and we gotta get this guy to surgery. So, now I gotta call and tell the doctor that I'm not gonna be able to do it at that time because my medication was not administered. Okay, which is, I guess, not really a big deal, but kind of because the patient didn't receive the medication at the time they were supposed to. Alright. Trying to think of anything else I'm missing. Basically, knowing what primary, what secondary is, what tubing you use, what a TKO is what you're gonna need for competency. Personally, they did not make me set this up. So me showing you guys this is going to be strictly for your purpose at clinical. Because at clinical, I did a bunch of this. I did a bunch of IV piggybacks with my nurse just standing there watching me, obviously not on my own. But, I mean, Miss Ronnie or whoever's proctoring could change it, but I'm just letting you guys know I didn't set everything up.
This is
So they
the
just-
station you got the car.
This is the station I got.
They just asked you questions.
They just asked me questions about it. I did
You set
a
up
physical
piggyback
assessment.
up?
Huh?
You actually set up a piggyback?
I didn't. Everything was set up. I
Did you
came
program?
in and I
Literally just like a
just
questionnaire.
talked. Yeah, it was like a questionnaire. So I'm not sure, like I said, if they'll do the same thing for you guys, but the point of practicing this is just so that, if they do, or for clinical practice. Right. Does anybody want to see me do it again, or feel like they could do it on their own?
One was good.
I know it's a lot. One was